I don't know much about your background in terms of where your practice is or where you come from.
Sure. I'm in San Diego currently.
Okay.
My medical practice used to be in Montana, and that's where I started my supplement company, MBI. That's where I started all the research on bone health and osteoporosis, and was writing professional articles and consumer articles, and have continued to do that. But that's where this interest in bone health originated, because I had patients coming to me with osteoporosis and I was helping them. I thought I was doing all
Yeah.
the right stuff. Their bone density test numbers were going up. Then what happened was my mother-in-law has osteoporosis, and she was
Yeah. I
working
remember
with
reading
her
this.
doctor and a medical doctor and taking Fosamax. And I was giving her some recommendations and helping her a little bit nutritionally. Her bone density was going up. So she was happy. Her doctors were happy. Everybody was happy. Then she
Yeah.
tripped and fell and broke her hip. And I thought something's wrong with this picture, because by that objective measure, which is the
Yeah.
almost exclusively what's tracked when people go in and are treated for osteoporosis, she should have been protected and she wasn't. And so I started looking at the research and shockingly discovered that we'd known for decades that a bone density test is not a fantastic predictor of fracture risk. In women with osteoporosis, it only predicts 44% of them who will break a bone, and only 21% of men. And every medical association that's looked at the data they've correctly concluded that fracture risk depends on factors largely other than bone density. So it's just one piece of a larger puzzle. And as I started going more and deeper and deeper into the research, I discovered many scientifically supported, evidence-based ways from a holistic point of view that people can in fact grow stronger bones. They can support their bone strength, promote healthy bone density, but most importantly, that have been shown in studies to reduce fractures from a holistic perspective. So I'm in San Diego now, but that's sort of the genesis story of my interest in this.
And I think a lot of people believe that, or we're sort of even taught in medical school that our bones sort of hit their peak at 22 or 25 or something, that's as strong as they're going to get. Is that true? Is there still building going on after that point?
There's building going on throughout our life. It's a process called bone remodeling. And in healthy bone, there's a balance. So bone remodeling occurs when old worn out bone is broken down by a type of cell called osteoclast, and new healthy
Mm-hmm.
bone is created by a type of cell called an osteoblast. And that has to constantly go on. In fact, it's not isolated to just bone. Cells throughout our body are doing that in different tissues our entire lives. And in fact, in bone, about every 10 years, you have complete bone turnover, meaning all new bone is there. We reach our peak bone mass, that is bone density, in our 20s.
Okay.
But it's important to understand that that's only the mineral component of bone. A bone density
Okay.
test and bone mineral density test results is only looking at the minerals in bone. There is another very important component of bone, and that's the collagen and the proteins in bone. And that's what actually gives bone its ultimate strength. In fact, there are
Mm-hmm.
about 180 to 200 different types of proteins in bone, in addition to collagen. And that is something that's often overlooked and misunderstood with that statement of, oh, you reach your peak bone mass, or your bones are as strong as they're going to get in your 20s. And it's just this one-way street downhill for deterioration and ultimate, destruction of bone and death. And that's not actually what the research shows. It's not how the body works. And there are plenty of things we can do to reverse that. In fact, osteoporosis is essentially a condition of imbalance where the destructive forces are winning, and it's our job to reestablish that balance. And there are ways that people can do that.
Yeah. And part of my reason for wanting to talk to you is because I'm getting more and more people coming, just that because I worked in fitness and, kind of trying to work on helping people have healthier structure in general. they're coming to me, asking me for exercises on this kind of stuff. But and I know that is part of it, but it also seems like what we're learning about bones has really, like, just in the last like 15-20 years become true science. Like, from what you have written in your book, it seems like there was kind of a shift that happened around 2008 or somewhere around there, where we started looking at different ways of testing. And is that actually being implemented now? Or are we still, when people are being led towards Fosamax or something for support, from a pharmaceutical point of view, are we, what kind of testing are we doing for that? And is it a mistake to jump right into that before doing some other things?
So there's a couple different things to unpack in that, and you make some excellent points, and there's some excellent questions in there and topics. So one is testing, and one is treatment. So conventionally, the gold standard for osteoporosis screening and diagnosis is the bone density test, and that's an X-ray. That's been around since the 1940s, really, and that has not changed. That's when I said it only predicts 44% of women with osteoporosis will break a bone. That's based on those bone density test results.
Okay.
It only measures the mineral
From the X-ray.
Correct. Now, it's helpful. Don't get me wrong. And I think it's important
Right.
that people get tested and get
one piece of information.
Yeah, follow-up screening to track progress, because that's one piece of a larger puzzle. Since that time, however, there are additional testing methods that have been developed. So one of them is a CT scan, or a quantitative CT scan. If somebody has already had, for example, an abdominal CT done, that can sometimes be repurposed by the radiologist to give a bone density equivalent. And so that may be important to understand for your listeners. If they've already had incidentally a CT done, they may be able to get some information out of that tells them about their bone health that wasn't reported initially, and they just would have to ask for it.
Yeah.
The other thing would be ultrasound. So there's ultrasound that's just sound waves, so people are not exposed to the radiation that occurs with a CT scan or a bone density test. And that can be helpful in looking at bone quality, but there are challenges to all the testing. And one of the challenges with the ultrasound is that those individual devices, which are great because they are portable and they're more accessible, so they can be in doctors' offices or at health fairs to get more people screened, because most people aren't getting screened, unfortunately. About 95% of eligible Medicare patients, for example,
is that right?
Not being screened for osteoporosis, which is tragic and with really deadly consequences. Because if you have osteoporosis and fracture a hip, there's up to a 36% chance that you're going to be dead within a year. And if you happen to survive, about half of those people never regain their full pain-free level of mobility and enjoyment of their lifestyle that they had before. And about 20% need ongoing care, ongoing help with their activities of daily living, meaning dressing themselves, going to the bathroom, shopping, those sorts of things. And in fact, osteoporosis fractures account for more days spent in the hospital than other diseases like diabetes, heart attacks, and breast cancer. And a woman's risk for an osteoporosis fracture is equal to her combined risk of breast, uterine, and ovarian cancers.
Wow.
And so getting tested, getting screened is really important. One of the challenges with the ultrasound testing equipment is that there's no standardization in the industry of which variables are more important, or reference ranges off of which these results are standardized between the different manufacturers. And so every ultrasound machine and manufacturer of that machine has to validate the test result and provide the reference ranges to the clinician, to the technician. And it has to be validated. So that's really puts pressure on the practitioner to make sure that they're using the equipment as intended and using it only equipment that's been validated. And so it's up to, unfortunately, the customer, the patient, to ask that question. I go through that with people all the time. Like, these are the important questions to ask your doctor. Has it been validated? But even if somebody does get an ultrasound test result that shows some issues, that's really simply an opening to have the conversation and then refer them for a bone density test result. The other thing that has come up recently is a variation of the ultrasound. It's abbreviated REMS. It's an abdominal ultrasound test, and it's brand new. It only came out in 2019. It's been validated against the bone density test. And by validated, what do I mean? All of these testing methods, since a DEXA scan is the gold standard, are looked at, and the question is asked, are they as effective or more effective than predicting fractures than a bone density test? And we know that a bone density test is not that great, but it's the best we've got, or the best we've had. A CT scan, for example, is no better at predicting fractures than a DEXA scan. The quantitative ultrasound, the type that you may have in the doctor's office, that is no better at predicting fractures than a DEXA scan on machines that have been validated.
Okay.
The REMS test is an exciting development because they developed what's called a fracture score. And that looks at a database of bones from healthy individuals as young as 30 years old. And it compares your bones to somebody of your same age bracket. And it gives you a fracture score. And that was shown, at least in one study, to be even more predictive than a bone density test. There's only one validation study on it, so I'm waiting to see more data to verify that. But that's an exciting development. It's not widely available yet, but hopefully we're moving in that direction. There are lots of blood tests that are also available for people that some clinicians use, similar to the machines that's out there. There's a lot of challenges with using blood tests to predict fractures and to predict the rate of bone loss. Most of them are not recommended by any association because of that. So all of that just needs to be taken as pieces, small pieces of a much larger fracture risk assessment and profile. In fact, the most consistent predictor of fracture risk is not any test. It's somebody's gait and mobility, because 95% of fractures occur because somebody falls. So, in the health space and fitness space that you're in, anything we can do to improve balance and muscle mass and strength and reduce fall risk is necessarily going to also reduce the risk of fractures.
Yeah, and where I start with everybody, it doesn't matter whether you come to me as an older person or, a younger athlete. I'm most of the time I'm starting with a very baseline foundational, element, which is, looking at how the body is organized. If the head is in a forward position, if the pelvis is tilted in the wrong ways, if we can't stabilize our trunk, I know that eventually that's going to lead to a problem. So when I get somebody, or if I don't start working with somebody until they're 50s, 60s, 70s, or 80s, those are the pieces that I'm looking for ways to kind of work with right away, but not put them into any extreme flexion. In fact, as you say in your book, most people actually need to work on their extension. I mean, and that's partly due to lifestyle. And the more that we're like looking down at phones now and doing these kinds of things, that's just increasing all of this as well.
And that's a great point in terms of how you approach your clients and exercise. It really should be a very methodical, slow approach, because as we get older, even without osteoporosis, getting back into shape, exercising when you've been sedentary for many years, there is increased risk for injuries, no matter what the exercise is. Yeah. So making sure you're doing it safely with somebody who's trained to walk you through those steps to tailor something to your specific needs and your situation is important.
Yeah. And I always start with that stabilization piece, having the shoulders and trunk be able to stabilize well. And then, I always tell people, like, mobility has to come first. If we don't have mobile joints, if we can't get any sort of motion to the spine, the shoulders or hips, those are all, problems waiting to happen. Strength is actually an easy thing to gain. And I think a lot of people will just immediately like freak out when they hear that they have osteopenia and start trying to load their body. And that's, a recipe for disaster for most people.
There, you make some great points, and I think that it's important also for people to understand that it took decades for you to get in this situation. It's typically a
Right.
slow process, unless a medication you're taking has caused it. And there is a long list of medications that damage bone, cause osteoporosis, and increase fracture risk. But
Yeah, let's go there. I'm interested in hearing more about that after this. Yeah.
yeah, absolutely, it's an important topic. But with respect to exercise, I believe in the parable of the tortoise and the hare. Right? It's the
Yeah.
hare didn't win the race; it's the tortoise. It's that just one step after another, slow
Yeah.
and methodical, is going to get you back to a healthier life and to healthier physiology. And even just implementing things into your daily life is important. Walking, there's research that shows that walking just 7,000 to 7,500 steps is associated with a 50 to 70% reduction in all cause mortality. That's death from anything. So, park a couple rows further away from the front of the store, walk around the block. Or there are things you can do to even improve your balance just while you brush your teeth. I teach in my book,
Yeah.
and you probably read it and maybe already knew about it, the stork exercise. You stand on
Yeah. Yeah. It's great.
one foot while you brush the bottom teeth, and then you switch to the other foot with the top teeth. That
Yeah.
increases some balance, some stability, and everything is additive. It doesn't have to be, and I really advocate that it shouldn't be, that people think of exercise as solely, okay, I'm going to do this one block of time during my day of 30 minutes or 60 minutes, and then they just sit around the rest of the day. Moving
Right.
your body should just be part of the natural course of your day, with time set aside for definitely some very concerted, focused exercise. But
Yeah.
movement should be throughout the day.
Yep. I'm sure you've seen or read the Blue Zones, materials, Dan
Yeah.
Buettner's stuff, and it seems like most of the people in those, in the that's the Blue Zones are the places where there's the largest concentration of centenarians in the world, and what they've found is that these people living to be 100 or more, most of them have just generally worked movement into their days, whether it's chores or sheep herders or just kind of basic activities that they basically stay active. And I'm curious to get your take on how sunlight, or those natural UV, especially the red spectrum rays, affect bone health or just overall health.
Well, UV radiation, I mean,
Yeah.
sunlight is required to activate vitamin D in our bodies. And vitamin D does a lot of things. One of the things that it does is it helps promote healthy bone density. It increases calcium absorption through the intestines. It modulates inflammation, helps balance inflammation. Now, people I think, hear inflammation and they think it's a bad thing. We need inflammation. It's part of our immune system. The
Right.
problem that a lot of people are in these days is they have chronic inflammation. And so vitamin D, and there are many other things, diet most importantly, but that can help balance inflammation so that it's in a healthier balance. And when we're out in the sunlight, getting that full spectrum radiation from the sun, it's activating the vitamin D that's in our skin. Now, vitamin D comes from cholesterol. It's a precursor. So, people hear
Yeah.
cholesterol and I think it's all bad, but it's not. We need also healthy amounts of cholesterol to produce vitamin D, just as one example. Cholesterol, many other
Hmm.
things in the body. But vitamin D or getting that sunlight is important. The challenge is that people are spending more and more time indoors. People also are living at latitudes where in the winter the sun doesn't get high enough in the sky to activate the vitamin D receptors in the skin. So in North America, in the winter, anywhere north of essentially Santa Cruz, if you take Santa Cruz and go from California east across the country, anywhere north of that, the sun's not getting high enough. And there's even been studies in sunny climates like Phoenix, where they've tested people's vitamin D levels, and they're even don't have enough vitamin D. So supplementing with vitamin D for a lot of people is really important.
Yeah. Explain to me where people kind of, end up coming to you. Is it after a diagnosis? Do you get people who maybe know they have a history of bone loss in their families and are trying to prevent, or is it usually come after that, osteopenia diagnosis?
It's typically after somebody has been given the diagnosis. It's
Yeah.
not uncommon, I think, not just with osteoporosis, but any condition. People don't tend to be that proactive, unfortunately, about their health. We all
Yeah.
talk about prevention, but the reality is most people, if it's not a problem for them, they don't deal with it, and not just with health, but I think many areas of our lives. So I get them once they've gotten the diagnosis, typically.
Yeah.
And one of the first things I do is I put that bone density test results in it, like I did earlier in this interview, in its proper perspective, saying, take a deep breath. This is serious, but here's the reality of the test. Here's how predictive it is for fractures. It's not great. It's just one piece of a larger puzzle. This isn't an emergency. It's serious, but there's time for you to educate yourself and put together a holistic plan that makes sense for yourself, which is one of the big reasons why I wrote the book, to help people do that, walk them through that
Get organized,
process, get organized, give them questions to ask their doctors. And one of the important topics and questions to ask and review with doctors and their pharmacists, to go back to your point earlier, is the medications they're already taking. There's a long list of medications that damage bone, very common ones like antidepressants, anything that increases serotonin artificially, like the SSRI or SNRI categories of medications, Lexapro, Wellbutrin, Prozac. Those medications damage bone so much so that we know that studies have been done that we expect now for about every 19 people taking it, women taking it for 1 to 5 years, it would expect one person to break a bone. And most doctors don't realize that that's what they're doing. They're putting their patient at risk of osteoporosis and fractures by prescribing those medications. Similarly, women who are being treated with aromatase inhibitors for breast cancer or any estrogen receptor positive cancer, where they're suppressing the estrogen with aromatase inhibitors like anastrozole. We expect over 5 years, 20% of those women to fracture. And proton pump inhibitors, anything, the blocking acid, even the H2RA receptor. So that's proton pump inhibitors are Prilosec. Tagamet is an H2RA category. They block your stomach's ability to produce acid. Well, we need acid, and it turns out that one of the ramifications of blocking that production is that taking the PPIs for 4 years consecutively increases somebody's hip fracture risk by up to 60%. And it's not as if, suddenly there's no increased risk, and then at 4 years, it jumps up. It's going up the whole time. And those are just a few of many, many medications that are important to look at and evaluate, because if you want to restore bone health, it's important to remove things from your life that are creating the problems. And then what can we do to give the body the raw materials, to create the environment for your bone cells, your bone biochemistry to do what it wants to do anyway, which is to produce healthy tissue, to produce healthy, strong bones.
Yeah. And so in terms of prioritization and getting organized about this, is there a place you have people start usually with a program?
I have them start by looking at any medications they're taking. So
medications first.
Right. For me, it's imperative we can do, because also there are some medications that have been studied with some nutrients. And when those nutrients are provided with those medications, it stops the bone loss. Right. So it's important to understand the environment that we're dealing with, like what's happening in the body, and how can we then either mitigate the damage if they have to stay on the medication, or reverse it, or perhaps transition them to a safer medication, or ideally through holistic approach, integrated medicine, functional medicine, naturopathic medicine, whatever approach that resonates with somebody. Are they able to actually deal with whatever issues are are creating the problem that's causing them to be on the medication so that they no longer have to be on the medication. I'll give you an example. Acid blocking medications, half of those are prescribed for one condition, and that's acid reflux. But we know with
Mm-hmm.
simple dietary changes, you can fix acid reflux for a lot of people. There are 5 most common foods, or foods that most commonly create acid reflux. It's, tomatoes, citrus, raw garlic and onions, coffee, chocolate, and then spicy food could be a problem for people. It can be, you need to do a little experimenting and see what
Right.
your triggers might be. But just removing those offending foods or reducing the amount or how frequently you're eating them may take care of the problem so that you don't even have to be on an acid blocker. And that's the
Mm-hmm.
kind of approach that I like to take with people and encourage them to take and teach them to take in the book, because yes, there's a lot we can do to protect bones. There's a lot we can do to build bone strength back up, to maintain strong bones and improve bone density. But it's also looking at, where is somebody at now? How do we get them from point A to point B safely and
Yeah.
effectively? And a review of the medications is an important piece of that puzzle.
And I would imagine the anti-anxiety, antidepressant meds are probably the harder things to sort of transition people with if they've been taking them their whole lives. I mean, and there's also, a huge, new rate of younger people taking them as well. So, I'm just curious as to how you do that transition.
So when I was in my clinic in Montana, I was doing a lot of functional testing. I do now all
Yeah.
just, telehealth consulting with patients. I'm not ordering tests. I'll help them understand what questions to ask their doctors, what tests they need to order. But it's more just as a consulting role. The functional approach, looking at the underlying biochemical causes of diseases, I think is very
Yeah.
powerful, and it is supported in the literature as well. So specifically with depression, we know the hormones involved in mood, specifically serotonin and dopamine. And we know
Yeah.
your body can produce those hormones. They're produced from amino acids. Amino acids are the building blocks of proteins. And the starting amino acid for serotonin is tryptophan. You can only get it from your diet or dietary supplements. Your body cannot manufacture it. Similarly, with dopamine, the starting amino acid is phenylalanine, and you cannot get that from dietary from your body can't manufacture it. It has to be from diet or dietary supplements. And then they go down their biochemical pathways, and they're transformed along the way into different chemicals, into different amino acids, into different proteins, and eventually become tryptophan, or not tryptophan, serotonin in the case of tryptophan, which then goes on to produce melatonin in the body, and in the case of
Mm-hmm.
phenylalanine, to produce dopamine, and then that goes on to produce epinephrine and norepinephrine. And along the way down that pathway, it also produces your thyroid hormone. So we know all of the vitamins and minerals that are required for those steps along those pathways to produce those hormones that our body needs. And so we can test those through urinary organic acids, plasma amino acids, intracellular
Mm-hmm.
minerals. We can test many of those steps of those pathways and say, okay, are you producing enough dopamine or serotonin for yourself? And are you missing any of the nutrients required to produce healthy levels of
Right.
that? And it's a very customized approach, because then we know exactly what you're missing. Maybe you're just missing B6. Maybe you're missing phenylalanine. Maybe you're low in iron. So it can be a very
Yeah.
customized approach. And so I would work with patients on testing. And of course, with depression and these psychiatric conditions, I have to look also at situational issues. It's not always
Yeah.
biochemical. Maybe there's something going on in somebody's life situationally. Maybe they need to be in counseling or have some therapy of that sort.
Yeah. I'm very involved in, as you might imagine, in that kind of work, because most of the time I'm getting people who are led to me who have had some sort of traumatic,
Yep.
pass. And, so that their tendency to kind of go into that sympathetic fight or flight response is greater. And so, and these are the things that are going to deplete our systems in so many different ways, right? And so, that tends to be a good bridge when I'm working with, if I'm working with somebody who's really trying to come off of medications, but having somebody like, a naturopath also doing some testing and working with them through this, I find to be, and I do some work with naturopathy and functional medicine people, because I just feel like that triad of things really is helpful.
I found it to be incredibly helpful. And to answer your question of how do I transition people off, typically if I had them on this program after the testing, if they're getting counseling, they have the team in place, that then I want them to feel better and be stabilized for 6 weeks before I would start transitioning them off any medications.
Yeah.
And
yeah,
typically
I
I double the length of time that's typically done in conventional settings for weaning them off the medications. I like to go slower. I've seen too many side effects from going too fast with the medications.
Agreed. So, and you kind of mentioned the lifestyle parts in the book, and I think it's something that needs to probably be given more consideration than it does. We don't have enough time a lot of times in sessions with, or in an appointment with an MD to go through some of these things. But I imagine that you're in quite a bit of conversation, education, and you've got the book now to kind of help people get organized about that. But what are some of the other kind of lifestyle things that you tend to recommend for people?
One of the things very important to do is making sure that you have a strong social network. You mentioned the blue zones and movement and diet.
Yeah.
Yes, those are important. But one thing that the blue zones have that a lot of people are lacking in our society is an active and strong social network. And there is a chapter in my book just about this. I've never seen it in any other work on bone health.
I don't think I have either.
But the research is there that, in fact, if people have strong social networks, as people they can reach out to, people they do things with, their risk of chronic diseases, their risk of dying early is reduced. But there's even a research study that showed if they fracture a hip, they recover faster. And so that's an important piece, socially to have in place. Sleep is something else that's crucial, where a lot of people aren't getting enough sleep, but sleep deprivation, insomnia has a strong association with bone loss and osteoporosis. Plus, when people aren't getting enough sleep, they're more prone to accidents and falls and fractures. And so that's important to look at too. I mean, there's diet, there's sleep, there's exercise, there's social network, and there's dietary supplements. And yes, there are medications that are important to consider, but making sure it's the right one for you is important, because they're not all equally as effective. And so there's a whole chapter on medications in the book. And then also looking at supplementation, because it's not just about calcium and vitamin D. Yes, those are important, but those are minor nutrients compared to what the research shows can be even more beneficial when combined with another nutrient as well.
And interestingly, that whole social aspect of bone recovery, in those cases, it's kind of fascinating to think about maybe the hormonal aspects of all of this, right? Because we know that these things tend to shift, with menopause, and men have, that they don't have the same percentage of issues as women, but it's not that far behind, right? I think women are a little over 50% after menopause that tend to have,
for osteoporosis,
the likelihood of.
So it's 80-20.
Or is it greater than that?
Of osteoporosis cases are in women, about 20% in men. And yes, you mentioned menopause. It's the drop in estrogen that starts creating the more rapid bone loss in women. So through menopause and for the 10 years after is the time of the quickest bone loss in women. But men with testosterone, some testosterone in the body is converted to estrogen. And even though men's testosterone can go down, by and large, we're still producing some estrogen. That's thought to maintain bone health better in men as we get older, whereas women lose their estrogen. And that's what's creating the postmenopausal bone loss and osteoporosis, which can be effectively stopped, reversed, with fractures decreased by going on hormone replacement therapy. The research is quite strong in that. So there are opportunities for bioidentical hormone replacement therapy as somebody goes through menopause. Has been shown to have a 40% reduction in fractures, a 28% reduction in hip fractures just with hormone replacement therapy. And there are ways to do it safely. It's just important to work with an expert who understands how to do that safely.
Where I was trying to go with the social part of it was that if we have these good hormones kind of coming up in the system from having these social interactions, from having these connections, I imagine that sets off a number of different systems that help the body do its restorative processes too.
I think you're right. So there are, first of all, there are oxytocin receptors in bone. There's serotonin receptors in
interesting.
Bone. And so when people have, for example, healthy interactions and they get that boost in serotonin, they get increased oxytocin, they get increased dopamine naturally, not artificially elevated and sustained at those levels, from medications, but that has beneficial. Those hormones can have very beneficial effects on bone, as well as the fact that when people are socially active, when people are doing things with friends, and even with a partner, what happens is they're more likely to be physically active. And so that physical activity, as we already discussed, is also helpful. So it's this integrative web of interactions that when you're doing positive things, and research has shown this, if you're doing positive things in one domain, meaning you're being more socially active, or you're eating healthier, or you're exercising, what happens is people who do positive activities in one domain, they end up starting to do positive activities in other domains as well. And it just improves their entire physiology and their entire health.
And as an aside, I was surprised to learn in your book that melatonin is produced by, is it bone marrow?
No, it's produced by in the intestines, a type of cell called an enterochromaffin cell. And in fact, about 90% of melatonin is not produced in the brain at all. It's produced in the intestines. And I'm glad you brought that up, because there are melatonin receptors in bone.
Receptors, that's what it was. Okay.
And those help improve osteoblast activity. That means bone building activity. And that's the mechanism. It's thought one of the mechanisms by which insomnia starts to harm bone is because people have lower melatonin. And in fact, there's one clinical trial using melatonin in women with osteopenia, that's pre-osteoporosis, that's showing even taking just 1 milligram of melatonin per night improved bone density. So that is an important piece of the puzzle as well.
That's fascinating, actually. So sleep is obviously where we do all the recovery work, where the body does all the recovery work, or a lot of it, anyways. So we know that's got to be another factor. What else do you, in terms of supplementation? Is there anything that's a go-to in terms of when you get people that are on this, at this new starting point of wanting to really protect themselves?
Absolutely. And the issue is what works. What do clinical trials show work? If you look at bone support dietary supplements out there, some of them have, a few ingredients in it. Some of them have a whole long list of ingredients. And the question is, what does the research show is actually helpful and beneficial? And how do I evaluate that? So this is how I look at this. And I'm telling you this because it'll make sense then why my recommendations for supplementation is so limited. I don't recommend people take a ton of supplements for bone health. I like a very targeted approach.
I got that from your book. Yeah.
And the questions I ask when looking at the research is for bone health is which nutrients have been shown in clinical trials, not just to promote healthy bone density, but more importantly, to maintain strong bones as indicated by fewer fractures in clinical trials. And there are only 3 nutrients that I would recommend. There are 4 total that have been shown to do that, but only 3 that I would recommend. It's calcium and vitamin D. think that's a no-brainer for most people.
Yeah.
And a specific form of vitamin K2 called MK4. There are different types of vitamin K2 found in dietary supplements, MK7 and MK4. When I started this research back in 2006, 2007, I couldn't find any product that had the clinical dose of MK4, 45 milligrams per day in it, with calcium and vitamin D that I needed for to be working with my patients with to help support their bone health and promote bone health. And so I created an entire company to produce that and manufacture that solution called OsteoK. And now there's an OsteoK Minis. Those are the names of my products under my company, NBI. And
Mm-hmm.
I tell everybody this a bit as a disclaimer because look, I created a solution because I had a problem that I was trying to solve for my for people with whom I was working. But because they know now, and I have a dietary supplement, go to the website, look at the research, educate yourself, and make your own decision if it's a good fit for you. But the clinical trials are clear. 45 milligrams per day of MK4 has been shown not only repeatedly to promote healthy bone density, but to maintain strong bones, as indicated by over 70% fewer fractures in clinical trials. And those clinical trials were done mostly in women with postmenopausal osteoporosis, but there are also studies with MK4, and there's a study with men who are being treated with androgen deprivation therapy, typically used for prostate cancer, hormone blocker in men, that show that it stopped the bone loss. In multiple studies in people taking prednisone, which is very dangerous for bones, strips bones of calcium, damages collagen, increases fracture risk, show that it stops the bone loss from prednisone as well, from those glucocorticoids. But most importantly, again, maintain strong bones. And the biggest indicator for bone strength is not a bone density test result. It's whether somebody breaks a bone or not. And that's why looking at that, asking that question, have the nutrients been shown in clinical trials to maintain strong bones as indicated by fewer fractures in the volunteers? That's important. MK7, in contrast, only slows down, another form of vitamin K2, only slows down how fast somebody loses bone. It's not been shown in clinical trials to improve bone density, but more importantly, there are no studies showing that it maintains strong bones. There are no studies that looked at fractures as the endpoint in terms of bone strength. So my approach is very targeted. I don't want people to spend tons of money on things that aren't supported by the research. I want them to spend their money on what the research supports. And that's why OsteoK and OsteoK Minis only have the 3 ingredients, MK4, calcium, and vitamin D. And then I want them to spend their money on healthy food, on exercise, on making sure these other holistic things are important, that they're, that they should be doing, they're doing. There are other supplements that may be important, maybe a multivitamin. People say, what about magnesium? There's no research showing magnesium reduces fractures. Better to get your magnesium from food. Best to get your calcium from food as well. But you just can't get the amount of vitamin D and the amount of MK4 from food. And most people aren't getting enough calcium either. The average American woman gets about 800 milligrams of calcium in her diet per day. So getting about 400 milligrams as a dietary supplement, calcium dietary supplement, is sufficient to get women to that recommended 1,200 milligrams per day. Getting more than 1,200 milligrams per day of calcium, there's no evidence that there's better improvement in outcomes or that it's better for bone. And in fact, you can get too much calcium. Getting more than 2,000 or 2,500 milligrams per day from all sources is recommended against, because you can create some dangers that way.
So part of my reason for wanting to, maybe we can wrap this a little bit with this, is, I tend to treat a lot of people in health fields, and people who are, willing to go through and read the medical journals and research and are not convinced by Fosamax. And so either they're scared and have started, with the medication, or they're not willing to go there. Do you work with people who are, starting to get this some of this research now, some of the information that you're providing here and in the book, and it's obviously not your job to convince them to get off of medication, but if it's their goal to, they started on Fosamax and are realizing they actually want to do more work in prevention and building, is that something that you're doing a lot of work with, and how does that transition happen?
First of all, anybody can do all of the things that I recommend in the book while taking any of the osteoporosis medications.
Okay, that's what I
And
figured.
there are good reasons to take osteoporosis medications. They can be helpful. I think that for a lot of people who are being prescribed and told they need to take these medications, they're not being given enough information to,
or only do that.
right. They're told only to do that, or they feel pressure to do that, and they're not really given enough time to do their own research or learn more to make the best decision possible. The reality with the bisphosphonate medications, and the big question I ask in the book is, and this goes for any medication, frankly, is the medication that's being recommended, has it been shown in your medical case? Let's say postmenopausal woman with osteoporosis who's never broken a bone before, who has never had an osteoporosis fracture before. Has the medication that's being recommended been shown in clinical trials to prevent you from having your first fracture? And what we see in the research is that most of the research studies are what are called secondary prevention clinical trials, meaning they enroll people who have already had an osteoporosis fracture, which automatically puts you at higher risk for an osteoporosis fracture. But if you've never had one before, then what we're trying to do is what's called primary fracture prevention. And the oral bisphosphonates have only been shown to reduce vertebral fractures if you've never had an osteoporosis fracture before, not hip fractures. The only medication that's been shown to prevent both hip and vertebral and hip fractures is intravenous Zometa. So those are the important nuances that, frankly, a lot of doctors don't understand either. Now, if you've already had an osteoporosis fracture, there are a lot of other medications, and a lot of the medications are definitely more effective and better choices. With respect to choosing a medication, though, that's not the only question to ask. The question to ask yourself is, can I be compliant? Am I going to commit to doing this month after month, year after year, in order to get the results? Because you have to take a medication for 70 to 80% of the time to get the benefits. And with the oral bisphosphonates, over half of the people who start taking them discontinue them within 1 year, and even a higher percentage after 2 years because of the side effects. So understanding that may mean that, hey, an oral bisphosphonate isn't the right choice for you, but maybe based on the research and what your bone density is, what your risk factors are, maybe Zometa would be a good choice, an intravenous bisphosphonate, or maybe Prolia, or denosumab is the generic, or maybe Tymlos, or there's lots of the research I go over in that the chapter in my book on medications. But my job is not to convince anybody to do anything. I see my job is to provide the research that exists, provide the information I've learned to help people make the best choices they can make for themselves.
Yeah, I agree. That's great. Well, thanks for letting me pick your brain. This is exactly what I was looking for.
Oh, good. I've had fun. Thank you for the opportunity.
Yeah, and I'll be sure to put links for your book in the show notes. So anyone looking for that, I'm assuming you have it's on your website as well. But I'm guessing
people can find that on my website, nbihealth.com, as well as a lot of my research on articles, products, and they can reach out to me and contact me through nbihealth.com as well if they need to.
Well, thanks, John. I appreciate your time.
Thank you.